So hi everybody. The last month we talked a lot about the appointment process. And of course, in that appointment, we know that you made the sale. We know that. So we're very proud of that happening. And so now you've got that member and a book of business. And so we're going to concentrate on retaining that member because that is very important. And retention is not only important for retaining the member, but it's also important for gaining referrals to increase your sales. And that's why it's important for you to build a retention strategy. Taking care of your members and building relationships with them is extremely important. And I can promise you, it's a lot easier to build relationships with your current members than it is to find new business. We've got a lot of people and we've got one on the call, I know, that just simply works their book of business. And you'll come to find that if you just simply work your book that you've got, it will just be amazing what you can do with just that book. But one of the first things that you can do is make sure, and this seems really silly, but make sure that you fill out your application correctly so that you don't have any issues. You don't want, first of all, to have to go back to the member and get another signature because you've done something incorrectly on the application. So just be diligent in that and make sure that you check to see if you have any, if that member might have any late enrollment penalties, so you can explain that to them. So there's no surprises in that when you're there. And make sure that you have asked for referrals at that appointment. And you're going to hear Josh and I both say that a million times today, that you have asked for referrals. And one of the other things that we're going to talk about several times today is to make sure that you immediately send out a thank you card to that member when you get home, and include 3 of your business cards that they can give out to other people. So that's very important that you do that when you get home. And then one of the other things that you're going to do is in 10 days, you're going to make sure that you confirm your application status directly with the carrier. So you want to check, maybe if you've written a Humana plan, you want to check Vantage. If you've written a Blue Advantage plan, you want to make sure you check your portal just to follow the application and make sure that everything's going fine. And then you want to make a follow-up call to that member and just let them know what's about to happen. Just let them know that they're going to get an enrollment letter, a welcome kit, what's going to be happening next. They may have already received it, but just let them know what's about to happen. Thank them for their time and let them know that if they've got any questions or anything, that they've got your business card and they know how to get in touch with you. And make sure before you hang up the phone that you ask them for referrals, because they can be your biggest cheerleaders. If you've done all of these things, you've set all these things in place, they're going to be very happy with you and they're going to give out your card. So they can be your biggest cheerleaders, like I said.
And I just want to say this also, like this framework that we're giving you right now, the 10, 30, 60, 90-day calls, as you the longer you grow your book of business, you may tweak this a little bit, but this is a really good framework for new agents that it's tried and true throughout the years. And so like she's talking about, you're going to see that asking for referrals every time that you're reaching out to them, because they trust you. Okay. And they wouldn't answer the phone if they didn't trust you. So now you have made the sale and you're showing them that you're not just there just to make the sale. You're for them. You're with them after the sale. So once again, you're going to confirm that they received the enrollment packet. as that you talked about last time. And if they didn't receive their ID card, that's when you can actually help them register in their member portal and actually print their ID online. So that's a good opportunity there. And when we talk about opportunities, a lot of people, they're afraid to ask questions, to make these calls for one reason. Oh, I say one reason. This is what the biggest feedback that I've always got is I don't want to call them so much because I don't want to uncover problems. Because if I do that, then I'm going to get on the phone and just be on the phone forever and having to deal with issues. But I see it as an opportunity for us to shore up that relationship, with them. So cover all the plan resources, remind them about the over-the-counter benefits, wellness and preventive care benefits. And if they're like, they want to get started with like silver sneakers, go locate a silver sneakers near them. You've probably already done that in the appointment, but just remind them to do those things. Remind them to review the wellness visit and specialist appointments, make sure they made their initial wellness appointment with their PCP and that they're actually using their plan that they have. Any drug, pharmacy benefits, drug questions that they may have. By now, they're getting close to starting to fill those prescriptions, probably in that second month, because most of the time, a lot of people they'll try to get those 3 month supplies for the new plan kicks in. But just keep asking them questions. Don't worry about bothering them. You're not bothering them. You're helping them, and just remind them, hey, I'm going to give you another call. And just keep checking in with you, see if you need anything. And then once again, ask for referrals. Can't say it enough.
Hey, can I say something about about what you just said?
Absolutely.
Right. Okay, so when I usually get in touch with my people, I watch the status, where they're, is pending, and then I forget the other A word, but then it goes active. And once it gets active, I'm going to call them and let them know that that their plan has been has gone active and everything's looking good if it is. And I think that helps a lot to relieve some tension. But I always tell my folks, and I've got good retention rates, man. I lost 3 people this year, and I was expecting to lose a boatload because of the drug changes and everything. And I ended up losing only 3. And I thought that was pretty doggone good because I added a whole bunch more than that. And I never pay for referrals. I haven't paid for referrals in years just because people like me and they'll give me a referral. And I'll tell them, you may not know a Medicare person, but you may know somebody that's younger than you that needs a good ACA plan. And so I just lay it all out. But one of the things that I have found that really helps is I'll say, now, when you get your packet of materials, there's going to be some numbers on there that you're going to want to call to sign up for those programs. Okay. But if you've got questions, don't call the carrier, call me. And if we need to call the carrier, we will. But call me first, because there's a whole lot of things that I can answer for you that you're going to get yourself confused and in trouble if you call that 1-800 number, because you'll never talk to that person again. But you've got me. I'm local and I love you, and I'm going to answer your questions. So call me first, and then if we need to make a 3-way or if I need to follow up, I will do that and get back to you real quick. And that has helped me no end with my retention and getting referrals, because they know then that I care about them as people and I want to respond to their felt needs. Does that make sense to you, what I'm saying?
Oh yeah, that makes perfect sense. And hey, thank you for talking and speaking up on this stuff. And anybody else, because I know we have a lot of seasoned agents on the call, please feel free to do this, because there's a reason why you have that retention rate, because you care so much and you follow up, and that's perfect.
So then you can make a 60-day call. Your client should be real comfortable with the plan by this point. Just see how they're liking their benefits. See if there have been any recent changes to their health, if they've got any questions. Let them know again that you're going to check back with them soon. And again, ask for those referrals. And don't feel like like Josh said, don't feel like you're bothering them. They want to hear from you. You know, if they've got questions, they may feel like, well, I don't want to call that 800 number and I don't want to bother my agent, but you reaching out to them gives them that chance to ask those questions. Because a lot of times when I would call my people, they might say, you know what, I did have a question about that, but I just didn't want to bother you. And I didn't want to call that 800 number. So I'm glad you reached out to me. So always make sure that you make these calls.
Yeah, and also just remember they're seniors, okay? They're home, a lot of them, and like they need that companionship, you know. So this is actually it'll be really good for them. So on that 90-day call, just close the loop on anything that you talked about before. You know, make sure you take notes when you call these folks. I know if anything, I know that Lisa Gargis is very organized, and when she used to go meet with folks, she's gonna have a whole probably, if I had to guess, probably a whole index card full of everything about them, their family, and their granny. Um, so just make sure you're following up and that you show them you're actually working on their behalf. If you were trying to figure something out, you know, just do that again, and just remind them, hey, uh, you know, like I'm here helping you today. Once again, don't keep me a secret. This is what I do for a living, and a lot of people, a lot of your friends are calling these 1-800 numbers, and they don't need to. They need a local agent. So, and it just said after this, you know, you just want to make sure that you are, you know, touch base with them, you know, throughout the year. Make sure you're sending birthday cards. I know Lisa's going to talk a little bit about the importance of the birthday and the thank you card as well. But, you know, if anything happens, especially when it comes to September, they're going to get their annual notice of coverage or change or whatnot. And, you know, let them know that, hey, we're going to schedule that appointment with you. We're going to get in front of you. And if there's any changes, we'll let you know about it. And if there's anything that we need to do to get you on a better plan, that we'll do that as well. So, and then it says right here, just remember there is SEPs that are going on throughout the year. So when you're in front of them and they're asking you about their friends and family, you know, you might want to mention, hey, do you know anybody that goes to the VA to get their drug coverage? You know, now, do you know anybody that could benefit from you know, chronic special needs plan? Because those plans are going to still be our bread and butter as the year goes through. You know, after OEP this year. Lisa, what I know you're thinking about something. I know you want to say something on the thank you cards. Go for it.
You know, I was a big proponent of making sure that I had year-round touch points. I always had birthday parties that they came to. I made sure that every month I had a birthday party. So every, you know, they were always invited to something. Whether they came or not, at least they got an invitation to come. So I was touching my members that way. They always got, when I wrote a plan, the minute I got home, they got that thank you note from me with those cards in there. So I was making sure that they had that touch point from me. That was a big deal. And then just making sure that they always got invited to I had seminars when that annual notice of change came out every year in September, just to make sure that we got together, that they were not just getting something in the mail and not understanding that they're anything about their plan. So I made sure in September that I did some type of a seminar, that we got together and talked about their plan and what was happening with their plan. So just making sure that throughout the year you're doing something to touch base with your members. If you're not a person that wants to do birthday parties or things like that, at least make sure that you're sending out birthday cards. In some way, you're touching your members at least 3 times a year. I'm just a true believer in that. They need to be touched at least once a quarter.
Yeah.
Anybody?
Well, Lisa, I pulled some numbers. It's not in the slides or whatnot. And just on the top 5, well, there's a little bit more than that actually, disenrollment reasons for Medicare Advantage. And I want y'all to listen to this real quick, okay? I think this is very important because by us making these calls, we can, and like Frank was talking about earlier, you know, going in there and getting them, telling them to call you and not the carrier. You're going to, you know, retain that member by this. But it says 23% is financial reasons for disenrollment. Another 23% is problems with the coverage of doctors and hospitals. We know how stuff like that can happen. 13% is problems getting information. And here, look, we are a wealth of information. 11% is problems getting the actual care and coverage and cost information from their summary benefits, because half the time they've lost it. And then this right here, I can't believe it's not higher. I would think this would be like closer to number 1, but 8% is the prescription drug benefits and coverage. I think that would be a little bit higher. But my point of telling y'all that is you're calling for retention to help them with anything, to offset those issues that may arise. You're calling for referrals. Okay. So when you're with them, and you may, that 60-day call, it may be, hey, I'm in your area, let me come sit with you and go over something. That could be an option too. Not everybody's like that. If you ask Paul Todd, he does everything over the phone, you know, but Paige Phillips, she wants to be in the house, you know. So when you're going back to see them, just remember there's other things that you offer, GTL, that you might want to offer them and things like that. So getting in front of them and helping them out. And also, like I said, listening, because they may be part of a, you know, they may go to Brian Bryant's, you know, pickleball team or whatever. And so, hey, give my card out to the whatever, you know. So always listen and always be helping them. So, but go ahead,
Hey,
Lisa.
Lisa. Hey, I don't know if y'all can hear me. I've got bad service. Can you hear me, Lisa?
We can hear you.
Okay, cool. Hey, I'm not going to start rambling, but I just wanted to. I was looking at the people that were on the call, and, you know, some people, what you're describing is like super agent. If you were going to do it perfectly and do everything you can, these are all the things you should be doing to be the perfect agent. I just want to say, from a guy that wasn't superhero agent, if you can't do all of this stuff, just pick something, pick one thing, and be really, really consistent at it post enrollment. Because I was always the worst at, once I sent my apps in through UPS and I verified that they got processed, I was done. And I hope they didn't call me back. And then we didn't make another sale until the next AEP. And so, something my dad's famous for saying is, we got every referral that we deserved. Well, if you just gonna write the app, and back then, now I'm really throwing myself under the bus, but Lisa, you're guilty too, and Josh, you too. Humana used to tee up these appointments for us. So we would go to the appointment. We already knew what they wanted to buy. We'd sign them up. We'd send the enrollment in. Back to what we're talking about now. Back then, we didn't do anything else. We signed them up, and then if they called us, we'd help them. But past that, we wish they wouldn't call us. You know, we went off to do other things than Medicare outside of AEP. Well, nobody ever called us to sign up for anything during the year. The reason is they didn't think about us. We were out of sight and out of mind to them. Judy's got this thing at the office where 2 weeks after the enrollment, she makes a call to the member, and she's just checking to see, did you get your card? Are you getting your mail? You know, do you have any questions? If you didn't do anything else other than that, I think you would really progress in the referrals that you get. What Lisa's laying out is, if you're doing Medicare full time and you just wanted to do the best you could do, this is a perfect outline for that. If you can't do it all, just pick one thing and be consistent at it post enrollment. That's all I wanted to say.
Great points,
Absolutely.
Lee. And Lee, we grabbed, this was out of Lisa and Donna Bryant's template that we took these from, the super agents. So I just wanted to throw that out there. I was
There
with
you
you on
go.
that, buddy.
Yeah.
Absolutely. Lee is spot on. The key to, and this slide is the key to retaining clients is to never lose touch in the first place. Our point is just to be there, regardless. And one of those things is to just answer your phone. If you're not going to do any of these things, is just to answer your phone and be there for your member. So if they do have questions, that you're there to answer those questions. And just like Lee said, pick one of these things to do and just make sure you're there for your member if they've got any questions. Because otherwise, they're going to be looking for somebody that will be.
Lisa,
So
go ahead and
this-
take us home. Yeah.
Okay, so this last slide just kind of puts it all together. It just talks about communicating often and clearly with your members. Communication remains the foundation for a long-lasting relationship, and it doesn't stop after enrollment. As long as you're transparent, honest, and accurate as possible, your members will be more likely to not only give you their gratitude, but also their loyalty. When your member sees you as a trusted advocate, they tell others about you, and word of mouth is not only free, but it's powerful. Make servicing your members a priority. It could be as simple as writing them a note or sending them a birthday card. So, like we said, just be trustworthy, be honest with your member. When they see you as somebody that they can trust and somebody that they can count on, they're gonna put your name out there to everybody that they can, and that's where you're going to get your referrals from. I know there's several people on this call that simply live by referrals, and that's by their book of business just handing out their names. And so you can really build your business by that, as long as you start asking for referrals at every appointment. And that's just one thing that we want to get across to you today, is to make sure that you don't leave an appointment without asking for those referrals. These other things are just things that we suggest that you do. They'll help you, build your business with your book of business. So, like Lee said, just take one or two of them away today and try to start doing them. But just try to remember that, as long as you are honest and you're asking for those referrals with the people that you're working with now, I think you'll see your business grow.
Hey, we have.
now
Lisa.
Oh,
well, I was just gonna say, now that all the SCPs are gone, T65's where it's at, and they are looking to be referred. They do not want the mail and the call. They're getting them, and some people just, you know, succeed to it because they don't know who to call locally. But yeah, you can. We really need to be referred now more than ever.
hey, we have
Hey,
a
Lisa, I
question.
was going this,
Go ahead,
this Travis,
Travis.
just real quick. I'm sorry. So another thing that's going to be vitally important way back in the day, this is not the first time that we've been in lock-in where you couldn't write, an SPP, a dual or LIS during the middle of the year way back in the day. This is old school stuff for some of us, because there was a day when you couldn't do that.
Travis, I think
So we're going to have to
losing
be
you.
reckoned. We're going to have to be. Can you hear me?
I can hear you.
Yeah.
Yeah, so we're going to be raking and scraping and trying to find stuff. So when you do get a referral or you come across somebody that's got Medicare, a lot of these people are not going to have elections. The important thing to do is find out their income, because they may qualify for LIS. You help them apply for LIS. They have an election. You don't have to wait until AEP to write them. Stuff like that may qualify for Medicaid. Things like that. You just have to do stuff like that to make it work. So anyway.
Oh, thank you, Travis. I think we're close to having to switch over because of the to the next thing that y'all are doing, but we do have a question. It said, who do y'all use to send birthday cards, or do you send them yourselves? She said she sends them by emails, but maybe she should go back to real cards. I think as long as you're touching with them, having that the touch point, but A lot of people do like to write them, so they do the handwritten, you know, because some people open them. But Lisa, thoughts on that before we end this?
I think it's just a touch point, regardless of how they get it. Just as long as you're touching base with them, I think email is fine. If you want to do one, where you send it in the mail, you know, you can just go buy some birthday cards, or you could have some made. Angela Bailey can help you make some if you are familiar with Angela, or we can get you in touch with her. That's just totally up to you. But thanks, everybody. We appreciate you joining us today, and hopefully some of this information was helpful for you. We will make sure that we get this sent out to everyone.